Hip external rotation is an overlooked movement that, when limited, can impact your health and performance. Even in the research, not many people discuss hip external rotation deficits. But this study right here showed that if you cannot externally rotate the hip in a single leg squat, it may place more strain on the ACL. And another study showed that soccer players who lack this motion have almost double the risk of sustaining a muscle strain. So it's clear that it's important. But the problem is, rarely does anyone talk about how to improve this motion and do so in a way that is sound biomechanically. But that changes today, because in this video, you're going to learn the 3 strategies you need to improve your hip external rotation. More of this is going to allow you to better absorb landings, whether you're jumping, cutting, or sprinting. It's going to allow you to put better force into the ground, because that last bit of hip extension requires hip external rotation, and it's overall going to make you feel better. And if you stick around to the end of these 3 strategies, you're going to have some absolute killer moves that will take your hip mobility to the next level. But before I show you what those are, we need to understand how to improve hip external rotation anyways. What we're not going to do to improve ER is stretch and crank with reckless abandon. That doesn't work. What does work is influencing the pelvic biomechanics that contribute to a reduction in this motion. In order to externally rotate the hip, the acetabulum, the hole that the femur sits in, must point outward. This is called retroversion. The only way this can happen is if the sacrum can counter-nutate, which is the sacrum tipping backwards and the innominate rotating outward into ER. This opens up space to allow for hip external rotation. Now, the SI joint doesn't move that much, but what does change is the pelvic floor muscle activity. So when the sacrum counter-nutates, the posterior pelvic floor becomes more concentric, and the anterior pelvic floor becomes eccentric. So to drive this sacral counternutation, which promotes hip external rotation, bars, we have to do 3 things. The first thing we have to do is gain space to create external rotation. All of these strategies involve expanding the posterior upper, or the top part of the pelvis. The first is working from 0 to 60 degrees of hip flexion. This angle of hip flexion drives expansion into the upper part of the pelvis. We'll start with a wall squat. Get about 1 foot length away from the wall with a band just above the knees. You're gonna hold a kettlebell at about chest height. Looking straight ahead, you wanna contact 3 points. Your PSIS, which are the points just above the pelvis, inside heel, base of the big toe. You're gonna slide down. You should feel really heavy on those back points. Get a little bit of pressure into the band, not so much that your feet come up. You don't want the knees to go way outside of the feet right there. Hold this position, silently breathe in through the nose, soft, slow exhale through the mouth. Do 5 sets, 5 breaths, 2 times per day for 2 to 4 weeks before you progress to the goblet squat. The goblet squat works similar to the wall squat. This time you're going to be on a ramp, making sure you sense the inner heel and the base of the big toe. Keep the band pressure. You're going to inhale and exhale at the start, making sure the eyes stay forward. On the next inhale, you're going to drop down into a quarter squat, hold that position and breathe silently in through the nose, soft and slow through the mouth. You're going to start with 5 sets of 5 breaths, 2 times per day for 2 to 4 weeks. You can progress that to a dynamic version where you're inhaling on the way down, exhaling on the way up. Make sure to keep your weight on the inside heel and the base of the big toe, but stay a little bit more heel heavy on the way down. For that, go 2 to 3 sets of 10 to 12 reps. Once a day, 2 to 4 weeks for that. Once you've nailed the goblet squat, I would choose a Zercher squat as your predominant loading strategy. Still use ramp on this, but I wouldn't use the band at this point. The big key when it comes to Zerchers is keeping the foot points and then making sure your arms stay still. A common mistake people make is they'll let their arms drift forward as they're going down. You want to keep the weight close to the body so you get expansion in the pelvis. Start with 2 to 3 sets of 8 to 12 reps with that. You can eventually progress down to 3 to 4 sets of 6 as your load tolerance improves. The second thing you want to do, which is what helps with maximal force absorption and squat depth, is drive full hip flexion. When you can flex the hip all the way, the sacrum maximally counternutates. For full hip flexion, I like starting people with the single leg turtle roll. For this, you're going to bring one knee to the chest, making sure your eyes look straight ahead. Keep the other leg straight, keeping that knee glued to the chest. You're going to inhale, roll backwards, exhale, roll forwards. Make sure that you're not crunching or flexing your neck as you roll forwards. Try 2 to 3 sets of 10 rolls with that one. Once that's too easy, you can progress to the burner, the Cicinelli turtle roll. For this, you want to have a yoga block. You're going to put it between your knees and your elbows. You want knees touching and elbows touching together. Hands are going to rest on the forehead. You're going to inhale, roll backwards, exhale, roll forwards. The breaths will be more abrupt because this is a faster roll. Your first goal is to try to get up into position at the start. Once you can do that and you can bang out a few rolls, you can then make the block smaller. That way you get more and more flexion. I usually try to do 8 to 12 of those rolls for 2 to 3 sets, 2 to 4 weeks on that as well. Now that we've maximized the passive motion of hip external rotation, we want to put it to work. External rotation happens when we extend the hip beyond 0. So we need to learn how to push off in a way that promotes maximal external rotation. But these moves are not for the faint of heart. The way we're going to do that is by actually contacting the lateral femoral condyle or the outside knee. We can use this to really isolate the ER to the hips, and it'll absolutely destroy the glutes. But I got to warn you, this progression is not for the faint of heart. If you can make your way to the last move in this and do it well, your external rotation is going to be the best it's ever been. You're gonna feel like some biomechanics Jasmine, and I'll be your Aladdin. A whole new world! And don't you dare close your eyes. First move is a side lying 5-month. Lie on your side, the top arm and leg reach forward so you can log roll your torso onto 2 points, the bottom outside knee and the bottom outside elbow. If you can't get those points, you'll want to use ramps or some sort of elevation to tip you so you can contact them more easily. Once you sense those points, you're going to take a silent breath in through the nose. On the exhale, slowly push yourself up through those 2 points at a 3 to 4 out of 10 effort. You want to ramp up this pressure. You don't want to whip into place. Maintain that position. Breathe in through the nose, out through the mouth without sagging. Do 5 sets of 5 breaths 2 times per day per side for 2 to 4 weeks. You can progress that to a mid-lever side plank roll. The cues are pretty much the same. You're going to roll the torso over. What changes though is the contact points. You're still going to have the bottom outside knee, but now you're going to get the pisiform or the wiggly bone on the wrist, that's pinky side. To get that, make a C with your hand and then turn it over into pronation. Or my cue that I like is to pour one out for your homies. Once you've sensed those 2 points, you're going to breathe in through the nose. On the exhale, press yourself up into a side plank. Make sure you do not let the bottom knee slide. Hold that position for 5 sets, 5 breaths, 2 times per day for 2 to 4 weeks. Again, if you can't sense those points, use wedges to tip you into position. Want to up the difficulty of it? Lift the top leg up in the air. And I would do that before attempting this ultimate move because this is by far the hardest move within this progression. If you skip to this and you aren't ready, you're going to fail miserably. But you can go from the mid-lever side plank and rotate your entire torso away from the stance leg and arm. On this, you want to inhale, rotate backwards, pushing through those points. Exhale, back to the start. Try 2 to 3 sets of 6 to 10 rotations per side. And if you can do that, you're gonna have crazy hip external rotation. Now, maybe as you've gone through this progression, you've realized that, I also don't have full hip internal rotation. If you want to improve that motion, which is critical for overall health and well-being, I would check out this video right here, which outlines the most up-to-date and best hip internal rotation program out there.